and welcome to the Shatkin F.I.R.S.T Monday Morning Minute.
So we're actually going to use a 375 by 13 millimeter implant. I'm making my pilot hole just along the extraction site, a little bit to the distal of the socket, but we're going to go ahead and try to get this. This is the mono implant. I just got to get it started in the. Let's see if we can get that. Sometimes it's a little tricky here to get the initial. We're paralleling the canine root. Okay, let's see. Try to get that pilot hole started. Sectioning the socket, please. I need a drill extender, please. Okay.
Yeah.
My handpiece is just bumping into the tooth next to it, so we're going to do a little drill extender here. Any pain? Okay. And the driver, please.
I saw it somewhere.
I need it. Okay. All right, we got it started. Now I'm going to use the contra angle driver to place it because the space is limited there. Don't really have room for the ratchet, but hear the beeping. We've got 30 Newton centimeters of torque here. Section here, please. We're at 30, so now we're going to go to 60. That's good. Now, I need that driver.
Okay.
All right, so I'm going to just turn this another turn or two. And now we're going to do a little bit of a bend on it because of the angulation. So this is a bendable mono implant. Okay, and there we are. Looks good. Maybe we can do a tiny bit more here. Okay, perfect. Okay, bite together. That's excellent. All right, let me have a bone, please. Restore Plus. Surgical scissors. Just going to trim a little of this tissue right here that's a little inflamed there. They might not. Do you have one? It's okay. Okay. We're going to pack a little bit of Restore Plus in here. little pressure. So I'm just packing the Restore Plus in here around the extraction just to help it heal. It'll help it to fill in with bone more rapidly. Okay, now now we're going to just make a nice temporary here. Composite.
A1.
Yeah, A1 should be good, or A2. Bulk fill composite. Roll it into a little ball. And I form a tooth over it. Get it covered. Okay, go ahead and cure that. I'll take a little bit more. I had some hair.
Here, I have it for you.
Okay. Bite together. Open. Almost done here. And bite again. Okay, cure the back. Open. And a little tiny bit more on this ledge. Okay. Okay, cure that. All right, I'll do a little bit of shaping and check the bite, and we'll be in good shape here. All right, very good. Section for me. Kind of make them look good for the nurses. Look at that. Bite together. Open. Put in a little bit. We want to keep it very light occlusion. Open for me. It's hitting too much here, so we're going to adjust it. Bite again. Open. A little bit more. My son joined me in practice now. I'll introduce you to him. Bite together. Open. Okay, I think we're in good shape. Very good. Mirror. Okay, Jose, take a look. You got a tooth.
All right, that is great.
All right.
Todd, thank you so much.
Yeah. Does it feel okay when you bite?
It does.
All right. Excellent.
It feels really good.
We're gonna get a post-op X-ray, okay, and you'll show
Okay.
it to me. Thank you for joining us on the Monday Morning Minute. We'll show you the X-ray in just a minute. We'll see you next time.
Just a reminder, folks, on May 14th and 15th, we have our May intro course coming up. You'll be able to see live surgeries with Dr. Shatkin, learn all about one-piece mini and mono implants, participate in hands-on training, and earn up to 16 CE credits. If you want to take advantage of our spring special, please give us a call today and say that you saw the Monday Morning Minute so you can take advantage of our spring special and take $200 off the course. Typically it's $9.95, but with this special, it's going to be only $7.95. So if you want to come see live surgery, participate in hands-on training, and learn all about one-piece mini and mono implants, join us May 14th and 15th, 2026. We'd love to hear from you.